Okay, so I'd like to welcome everybody to the February 12th, 2025 special meeting of the Oregon Healthcare Workforce Committee. Uh, and let's see here. Uh, when we start off the meeting, I'm Ian Strauss. I'm the chair of the committee. Excuse me. And let's see. Why don't we, next slide? Where are we at? Next slide. Okay. So this meeting is open to the public. It does welcome public testimony, and we will have a section for public testimony later on in this meeting. The meeting will be recorded. Live transcription will be available. And if you're a member of the committee, please put CM before your name. And if you can, turn on your camera so that we can recognize you and make it easier to know who we've got on the meeting. Next slide. We have a pretty busy meeting for our hour and a half this morning. Uh, we will be, again, as I mentioned, taking public comment, getting an update from the Oregon Health Policy Board representative on our meeting, having a brief update on the grants pass, the rural tax credit parameters. Then moving on to the preliminary recommendations report from the Gender Affirming Care Provider Work Group, which has been a part of the committee as well as working with the Health Equity Committee and the OHA staff. So we'll be doing that. There will be a vote as part of that presentation. And so that we, please look at it from that perspective, committee members. And then we'll look at our next steps for the healthcare workforce needs assessment, which is one of the reports we do every other year coming up. So next slide. So because we've gotten so large at this point, we're going to do our introductions as a roll call this time around. So I'll call out names. Please give us your name, who you represent. Aaron Hines, are you with us today, Aaron? Elena.
Good morning, everyone. My name's Elena Shablowski. I use she and her pronouns. I'm a dentist at La Clinica, which is a federally qualified health center in Medford. And I think that's it.
Okay, great. Alicia Jackson.
Hi, everyone. Pardon, I don't have a voice right now, recovering from a cold, but I'm Alicia Jackson. I'm a family medicine doctor, also faculty at OHSU. I work out at Hillsborough Medical Center and one of the associate program directors for our family medicine residency program.
Okay, Koivu.
Morning, everyone. Koivu, pronounced she, her, hers. I'm the executive director of the Coalition Community Health Clinics.
Just to make sure, Eric Weiser, are you with us today? Riela Carrillo.
Hi, good morning, everyone. My name is Gabby Carrillo. I am the Director of Clinical Placement at Sumner College School of Nursing.
All right. Gretchen Horton Dunbar. Okay. Jason Johnson.
Good morning, everybody. My name is Jason Johnson. I use he, him pronouns. I am a program dean at Portland Community College and support a portfolio of healthcare programs. Been committee member for 6 to 7 years at this point. Good to see everyone.
All right. Welcome. Judy Geiger. Kelly McKnight.
Good morning, everyone. I'm Kelly McKnight. I use she, her pronouns. I'm the Chief Executive Officer for Options Counseling and Family Services. It's great to be here this morning.
Laura Chan. Laura McKean. Okay. Levi Anderson.
Hello, good morning. I'm Levi Anderson with the Self-Sufficiency Program for Oregon Department of Human Services, and I help out in Grant, Harney, and Malheur counties, and I use he, him pronouns. Thank you, thank you.
All right. Manu Chaudhry. Megan Holland.
Hi, I'm Megan Holland, she, her pronouns. I am a family doctor in Coquille at a critical access hospital, Coquille Valley Hospital on the South Coast, and I'm campus for rural health from OHSU.
Okay, welcome. Molly Reynolds.
Hey everyone, my name is Molly Reynolds. I'm a program manager with Rise Partnership. Rise Partnership is a labor management organization, a partnership where we help support home care workers and personal support workers, providing training and career pathways. Happy to be here.
All right, thank you. Rob Ross.
Hi, I'm Rob Ross, he, him. I'm a family doctor by training, but I'm the Director of Academics and Research at St. Charles in Bend.
Lieberman.
Hi, I'm Bob Lieberman, live down here in Grants Pass, and I have a training and consulting business, spent 40 years running a children's mental health organization for children and families.
Okay, Dr. Rosemary Hemmings.
Hi, good morning, Dr. Hemmings. I own a group mental health practice in Beaverton that focuses on cultural linguistic specific services in the state of Oregon. Thank you.
All right, thanks for joining us. Stephanie Green. Okay, Surya.
Hi, this is Surya Karlapati. I'm a psychiatrist at the Oregon State Hospital here in Salem. Thanks.
Okay, and Tessa Christensen.
Good morning. I am Tessa Christensen, use she, her, hers, and I am an executive assistant slash contracts manager for Best Care Treatment Services.
Okay, well, thank you and welcome all committee members. We're getting to be a much larger group this year. We've added more people, definitely a little more of a trick to keep track of everybody. So thank you all for listening. We also want to welcome our guests and OHA staff. If you're a guest or an OHA staff member, if you would please put your name and organization in the chat. Okay. And here's just a list of the folks that we currently have from the OHA staff. Folks who have done a great job, so we want to recognize them all. Okay, so one thing we do for our, since it's such a guiding force for the work that we do here in the committee, is we review the definition of the health equity framework, the health equity definition and framework every meeting. So I'm going to take a moment and just read out the current health equity definition. Oregon will have established a health system that creates health equity when all people can reach their full health potential and well-being and are not disadvantaged by their race, ethnicity, language, disability, age, gender identity, sexual orientation, social class, intersections among these communities or identities, or other socially determined social circumstances. Achieving health equity requires the ongoing collaboration of all regions and sectors of the state, including tribal governments, to address the equitable distribution or redistribution of resources and power, and recognizing, reconciling, and rectifying historical and contemporary injustices. Okay, next slide. Now, some of the framework that we have a series of guiding questions. I'm not going to go over each individual question, but this information is available on the committee website as well as for those of you who've had this downloaded, this information. These are kind of questions to think about when you come into the meeting to get to put it in context of where we're heading and the things that we're doing. Next slide. Okay, so the next piece for today's meeting is to review and approve the January meeting summary, so the meeting minutes. Does anybody have any comments, updates, or corrections for the January meeting summary that was sent out prior to this meeting?
No, sorry to interrupt. Let the record show that Judy Geiger, a committee member, has joined us.
Okay, Judy. Okay, so anybody, any updates, corrections, feedback on the meeting minutes from January? So it looks like we need a motion to approve.
I would move to approve the meeting minutes from January. It's Rob.
And this is Elena. I'll second.
Great. So raise your hand for if you are able to approve these meeting minutes. Okay. Lower our hand. Any folks who cannot approve the minutes?
I put it in the chat, but I wasn't here last month, so abstained from voting.
So that's our third option. No problem. Yep. Bob, I'm assuming that your hand is still just up. Is that, or are you a no? Good. All right, and abstained. Looks like we have Kelly McKnight. Anyone else abstaining? It looks like that's approved. Next slide. Okay. So, as I mentioned earlier, this meeting does take public comment. Now, the Healthcare Workforce Committee welcomes and deeply appreciates public testimony. It's one of the most powerful ways we demonstrate our commitment to profound listening and learning. Deep listening means that we will not respond to what you share, nor will we attempt to fix or resolve the question or concern that you bring today. We will also not interject to correct inaccurate comments that are shared as fact. We will, however, bring it fully into our awareness, understand it as an important consideration for our work, and listen with careful attention, respect, and honor that you deserve. We want to acknowledge that time held in our meeting to hear public testimony is meant to provide a voice and perspective from the individual and is not a representation of the committee or the OHA. Each presenter will be given 2 to 3 minutes to share. In the event that that doesn't feel like we've given you enough time, then please provide written testimony, which we will commit to reading. To help keep us on time, okay, we won't be doing a timer. Please know that written and verbal public comments will be reviewed and discussed following each meeting by the committee chairs, so the staff and the OHA, and determine the appropriate next steps. I believe we do have public comment today.
We do. We have one person. We have a nurse. Let me see if they've signed in.
I'm here.
Oh, please feel free to introduce yourself and your preferred pronouns and give a brief public comment. Thank you.
Okay. My name is Suki Rain. I use she, her pronouns. I am a bedside nurse at Kaiser Sunnyside Medical Center. I'm currently in an MSN program at Gonzaga University for psychiatric mental health nurse practitioner. And my public comment is just, I'm in communication with several other students who are in online asynchronous programs across the country. And we're having a great deal of difficulty securing clinical placement sites. I have several people who have said that Unity, as of this semester, is no longer taking students unless they are OHSU or legacy employees. Portland Mental Health and Wellness just closed their program. So I have two friends who lost their clinical placements for May and August. I have another coworker who has been emailing and reaching out to different sites for 6 months. She just lost a placement in Vancouver. No one is returning her emails at Oregon State Hospital, and she needs to start clinicals this May. And she's unable to find a preceptor. I myself have not begun clinicals. I know that I need to start looking now for my fall semester, and that's a late start. And I'm worried about securing my own clinical placements as well as my future mental health placements. I've been told the VA has a 1-year wait list. I've been told, although I work for Kaiser, they will not find me a preceptor. They just have a clinical placement coordinator who will help me work out all the details to secure my site. So I'm concerned as a student. I know other students who've had to take a whole semester off because they either lost their site or they have not been able to find a site. And that concerns me. And the schools that we're attending don't give us a lot of help. I believe that they have to assist with clinical placement for accreditation, but from everybody that I've spoken to, they have had to email hundreds of emails to find their own sites. And I worry about penalizing the programs because then that will limit the amount of programs that are available to students who are interested within the state of Oregon. But I don't know if there's a way to work with these programs such as Gonzaga, Frontier, Walden University, Norwich University to help students who are in an MSN mental health tract secure their clinical placement sites. Thank you.
Okay, thank you for your comment. Thank you for joining us today. Okay.
We have another public comment. Josh, if you were still here and would like to give a comment, now would be a good time. Just introduce yourself.
Can you guys hear me okay?
Yes, we can hear you.
My name is Josh Leiden. I'm an LCSW and the CEO of Stronger Oregon. Hearing, I think it's Suki's comment, I don't know if it was MSW, but Masters of Social Work program participants can apply to us. We're opening up our ability to offer the things needed to get you through your master's. And so you can reach out to me via comment or find us online. But I may have misheard which program you're from. I'm wanting to comment about the recent developments from Care Oregon and from OHA that are having an impact on the mental health workforce. Essentially, the proposal is to force associate mental health providers into certain community mental health programs or what's called certificate of agreement programs. Now, this is not a product of your guys' report that was in January, a conclusion, or it seems like any input from this body. And I think being that this is a legislated group to actually have an impact on the workforce, that you guys should have more of a voice with OHA in regards to their decisions. I will say that the Health Equity Committee, part of OHA, has vocalized their concern in a letter that I sent you guys in the comments, as well as you can find it through the Lund Report. There's been a recent article as well, basically detailing like a pause and like a real evaluation on the impact of the workforce on clients and their ability to get access to mental health services and other implications, as opposed to just kind of instituting a regression on the rule passed in 2016. And I can give you an article, not an article, it's actually the DMAP and their own justification for the rule change at that time, where they said it was serious prejudice, the fact that they didn't have clinical social work associates, professional counseling associates, and marriage and family therapist associates as rendering providers for Medicaid. And I dug up a little bit more and looked at the federal rules that actually justify, or not justify, they basically protect this demographic from what's called provider type discrimination. Basically, these providers are high risk treating providers. They're preventing suicides, homicides, treating domestic violence across the state. And so there is a federal statute, if you're interested in actually knowing what that is, that protects this demographic, but vaguely. It doesn't literally name them. And there is a legislative concept that hopefully will be pushed to the floor and voted upon this legislative season to actually solidify protection for this provider type to render Medicaid services. I'll let the committee know when there's an actual name for the legislation. And so I just want the committee to actually consider these things, read these documents, read the Lund Report, look at what's happening in the legislative session that's actually going to have an impact on the workforce, what OHA is proposing, and whether or not it actually has a legal basis and soundness. And if you want the DMAP, I'll literally send it to you so you can read their own OHA justification that calls this serious prejudice. If you weave it all together, I think this committee should also be concerned. The letter that was written should have probably originated from this committee. And I think that the committee themselves may want to consider writing a letter also to the OHA policy board and or to the director of OHA or the governor or whoever is actually making these decisions, that there needs to be considerations on the implications for the workforce, because it absolutely ties directly to this committee. And you guys have tremendous power and voice in regards to the direction of what OHA does. I know that there's only been a preliminary report, but then at the end of this year, it'll be like solidified. I don't know if you guys are going to actually go the direction of what OHA is deciding.
Okay. So Josh, I'm sorry, but as I mentioned earlier, we've only got so much time in these meetings. We do appreciate your comment, and the written comment was submitted to the entire committee to review. So we'll take the chance to look at that offline. So once again, thank you. All right. So
Are there any additional public comments? Hearing none, moving on.
Okay,
I'm
next
sorry,
slide.
is there time for another one?
Ian, is there time for another public comment?
Do it.
Hi, so my name is Elizabeth Delbras Ryan. I'm an LCSW. I also have an MPH. I am the clinical director at Rooted Mental Health in Salem. My question is if this committee or if OHA is doing anything to prepare for potential changes in Medicaid funding and or block funding from the federal government, given some of the recent questionable constitutional validity executive orders around that funding, specifically for providing gender affirming care. So right now, my practice, we are a COA practice, and we provide several gender affirming care assessments and letters for medical care every month, specifically with the Medicaid population. And we are concerned about whether or not that work is going to continue to be funded, and if OHA is working on some sort of backup plan in the case that Medicaid and other federal funding falls through, and if there is any recourse that we can make sure that these clients are still getting the care that they need, both on the behavioral health side, but also ensuring that they have access to medical care as well.
Elizabeth, we will be going into that some pieces of that and what we know about the gender affirming care legislation later in this meeting. So would you be okay with waiting for a response until we can go that far?
Yes, absolutely. I mostly wanted to just get it on the record that it's, that is something that we're concerned about. Thank you.
Thank you. Okay. So let's move on. We have the OHPB updates. Melina? Next slide.
Hi. Hi, good morning, everybody. My name's Melina Moran. I use she, her pronouns. I am the OHPB liaison to this committee. I also work as a addiction medicine provider at Best Care Treatment Center. So I would like to just share with you our last meeting from the OHPB. It was on February 4th. We started out with an update from Dr. Hothy. She went into detail on the OHA's plan to eliminate health inequities by 2030 and what the strategic plan and the budget review looks like to reach this goal. She shared that there will be a dashboard launched. I believe it is active. It's on the OHA website, and this shows how this is going to be achieved through transparency, accountability, and including belonging. There also is a call to action to create collaboration throughout communities in Oregon. Next, she spoke about creating a federal response team. This team is an incident management team similar to the incident command system structure. This team is to monitor, evaluate, and address impacts that are happening on the federal level. They will be providing OHPB updates, I believe, monthly. There will be a website so that information can be disseminated. Next, we heard this was not on our original agenda, but it is a very important. Bill Kramer brought it up, and he proposed a draft statement of support of all Oregonians during the federal current administration changes and cuts. This letter was drafted by him, and after the meeting, 3 of the members continued to work on this letter. And it has gone out to the governor and the OHPB. And this is on the OHA. And this is on the OHPB website if you'd like to review it. Next, we heard from Bill Kramer and Tony German about the Affordability Committee. This is the new committee, and we discussed the structure, composition, and the charter. Last meeting, there was questions from your committee if there will be seats for traditional healthcare workers, oral health, peer mentors, etc. And yes, there will be seats on these committees. So there will be 2. There will be Affordability Committee. This committee has 9 members, and then there will also be an Industry Advisory Committee. This is a larger committee. It has 15 to 30 members. There is a slide presentation on our website, and I encourage you all to review that with the list of members who will be invited to join both of these committees. Both of the charters were adopted and are on our website. Next, we heard from OHPB members for feedback for CCOs. This include members from primary care, behavioral health, and more. We spent a large time hearing from the public during our public comment. A lot of these public comments were discussing the changes to the behavioral health associate providers. There are many comments for and against these changes. Next, we heard from the Health Equity Committee, and we reviewed and heard a letter to our committee about concerns about the associate providers in behavioral health and disallowing billing to OHP unless they worked for a CMHP or or had a certificate of approval for their organization. This letter made requests for action and laid out clear actions they would like the board to take. The board made a request for more data before any further discussion, decision, and action could be made. We were assured by the OHA that this rule has not been changed and will go through the rule-making process before it's implemented. So we're waiting for more data on that. Next, we heard from the Behavioral Health Committee lead staff requesting to modify committee membership. At this point, because it's statute, it's unknown if OHPB can actually change the membership. But we did move and approved pending that we have authority to do so. Our next meeting is March 4th, and we encourage all to attend, all who have public comment to participate in that process. Our next meeting after that is April 1st, and this will be a hybrid meeting in Corvallis, and more information to come on that. Thank you.
Okay, thank you, Melina. Okay, so do we have anyone doing OHA updates?
Ian, we don't have OHA updates today. Thanks.
Got it. Okay, next slide. Okay, next slide. Okay, so now we have a short presentation from folks from the Oregon Office of Rural Health on the status of the update on the rural tax credit parameters. I'm not sure who's doing that presentation.
And I believe that is me. I don't think my director, Robert Dumeg, is here. So I'll go ahead and step up. My name is Bill Funder. I use he, him pronouns, and I am the Incentives Program Manager at the Oregon Office of Rural Health. So the state of Oregon defines rural as a community that is more than 10 miles from a population centroid of 40,000 or more people. So a pin is dropped in the middle of a population centroid of 40,000 or more, and a circle is drawn around that, and that is as the crow flies and not as the truck drives. And the numbers for the population, the official source is Portland State University. And back late 2023, Portland State University alerted us that the community of Grants Pass had surpassed 40,000 residents. And that changed Grants Pass status from a rural community to an urban community, which meant that providers in that community would not be able to participate in the rural insurance subsidy program and the tax credit program. Along with my office and our partners at OHA, we worked with this committee and adjusted the criteria for participation in the insurance subsidy program to allow Grants Pass providers to participate for the foreseeable future. But we did not have the ability to alter the requirements for the rural practitioner tax credit. Well, we had been preparing for the past year, providers in that area to be prepared that they're not going to be able to participate in the tax credit program without legislative action. There were some bills brought up that are currently being reviewed. And then we just towards the end of 2024, so a couple months ago, we received word from Portland State University that they had readjusted some of their lenses at which they look at for to get their program, I'm sorry, their population data. And they let us know that Grants Pass had once again fallen below the 40,000 population threshold, moving it back to a rural community. And because that had taken place before the beginning of the when folks were supposed to be submitting their taxes, we were able to allow them to participate in the tax credit program. Meaning, thankfully, no providers from Grants Pass were left out of participating in both the tax credit program and the rural insurance subsidy program. So that is the update. The parameters for the tax credit require a legislative update. And again, there are a couple of bills aimed at doing that now, and we don't have the ability to change that criteria, but we will keep the committee updated as those bills make their way through the legislative process.
Yay, thanks, Bill. Good news. All right. Okay, and now we're going to move on to review and approve the Gender Affirming Care Provider Work Group report. Now, as Melina mentioned earlier, OHPB and the Oregon Health Policy Board, as well as the OHA, is keeping a close eye on what's going on with the federal government changes that we've been seeing in the news. But as things stand right now, there are no current changes to gender affirming care services being provided by Medicaid. I'm going to pass this on to some members of both the Healthcare Workforce Committee and the Health Equity Committee, who have been working on our gender affirming care work group. That would be Elena Shablonsky, Julia, I don't have your last name right, and Koi Vu from the Gender Affirming Care Provider Work Group.
Hi, good morning, everyone. Thanks so much, Ian. My name is Yulia Pshedvorsky. I use they, them pronouns. I am a member of the Health Equity Committee of the OHPB. And sorry, is this the right moment to go into the presentation? Or was there another thing the committee wanted to discuss before we launch into that?
Actually, introductions and then into the presentation.
Okay, great.
And Jessica, could you advance the slides, please? Yeah, keep going. There's introductions. That's where we are.
Sorry.
So just to finish out my introductions then, I am a queer and trans health equity researcher. And I also was on the Gender Affirming Care work group. And I am glad to be here and thank this committee for your work on this important issue. And I'll talk a little bit more about that in a bit. And I also have a couple of co-presenters from the task force or from the work group.
Yeah, I'll go first and then pass along to Koi. I already introduced myself, but for those of you that have joined since, my name is Elena Shablosky. I use she and her pronouns. I am a dentist and dental director at La Clinica, which is a federally qualified health center in Medford. And of a personal note, my cat, Simon, loves to get on my lap when I'm giving Zoom presentations. So you may also meet him at some point. Koi, you want to introduce yourself?
Yeah, thanks, Elena. Hi, everyone. I am Koi Vu, pronouns she or hers. I am part of the Healthcare Workforce Committee and also part of the Gender Affirming Care Work Group. I think there's someone else that we're handing off to, or is it just me? Is it? Okay.
I think Levi is also,
I think
Yeah,
Levi's, yeah, introduce yourself, Levi. I think we're kind of going together. I think Levi will play more of a role for some of the other committees and might chime in today too.
for sure. I jumped on just in case. My name's again Levi Anderson, and yes, I got to help with the Gender Affirming Care Work Group as part of the Health Care Workforce Committee.
Great. Thank you. So first, a little bit of background. I wanted to just also share. I had to spend most of the night in the ER with a friend who's okay now, but I'm a little tired, so I apologize if I am missing things. So any of the other work group members, if I misstate anything, please jump in. I'm a little sleepier than usual. I also want to acknowledge before going into the background here that this report was created and finalized in December. So we were not able to respond within this report to the current changes that are happening on the federal level. And it's something that is incredibly important for this committee and all of OHA to be tracking and be mindful of, because we know that there's a significant threat to the healthcare of numerous trans and non-binary Oregonians. So a little bit of background on this report. The Health Equity Committee in August of 2024 sent a letter to OHA's director, Dr. Hathi, requesting action to expand gender-affirming care, given that we know this is a significant issue of healthcare shortage in the state, and as well as a significant issue in terms of health equity and healthcare access for LGBTQIA2S+ communities. And in this letter, we made specific recommendations to address workforce issues and these inequalities. So then later in August, Dr. Hathi sent a letter to this committee requesting that you convene a gender affirming care provider work group to further examine and come up with a report. And in September of last year, the committee formed the Gender Affirming Care Provider Work Group in a response to Dr. Hathi's request. It was composed of a number of this committee's members, as well as two folks from the Health Equity Committee, myself and Beck Fox, as well as a number of providers who work with that provide gender affirming care. Next slide, please. And I apologize, I don't see the commenter notes here, and I'm actually covering for Beck's part right here, so I think I'm still supposed to present this slide, but my co-presenters, please feel free to jump in if I start presenting what was actually not mine. So the work group scope was to advise OHA and OHPB on ways to improve training, hiring, and retention of gender affirming care providers in partnership with the Health Equity Committee and OHA's Gender Affirming Care Work Group, and to launch conversations on this topic and report back to OHA Director with preliminary recommendations by February 2025. So that's what we're going to be presenting today, is our preliminary recommendations and the report that contain it. So by February 2025, the JAC, Gender Affirming Care Provider Work Group, will make short-term recommendations that don't require legislative actions and propose next steps for 2024 to 2027 to develop legislative action items to future legislative sessions. Next slide, please. Structure of the work group.
I'll take over from here. So like Yulia gave a great sort of brief sneak peek. Yeah, this is great. This slide shows some of the OHA staff, committees, and work groups that made up the work group. So like Yulia said, it was comprised of three different committees. So representatives from our committee, the Healthcare Workforce Committee, representatives from the Health Equity Committee, and then representatives from the House Bill 2235 work group on behavioral health workforce. The OHA staff was also highly involved and really supportive to make sure that everything went smoothly, which mostly it did. Like Yulia mentioned, we were on a pretty quick timeline, and so that support from OHA staff was so important. We within OHA staff, you can see the list on the screen here, but we had representation from the Equity and Inclusion Division, the Health Policy and Analytics Division, the Behavioral Health Division, and the External Relations Division, which deals with government relations. We also couldn't have done it without help from our consultants from the Hein Consulting Group and Anderson Nathy Consulting Group that played a huge role in creating the report and facilitating work group meetings and then drafting and refining the report itself. They also made sure to include and center the needs of an input from work group members first and foremost. So they were awesome facilitators and supporters of our work. Specific people that were part of this were Michael, Alana, and Cindy. So that's a look at who was in the room where it happened, as it were. And we can go to the next slide, the virtual room where it happened. And then here on the screen, you see names of organizations that were represented by work group members. We wanted to be careful not to name specific individual names for anonymity and safety, to be frank. And so you can see their organizations listed here. You can see that we've included some FQHCs, CCOs, and advocacy groups. And the work group members also brought their lived and personal and cross-cultural experiences, and that included experiences across the spectrum of LGBTQIA2+ communities, which was super awesome. I think we all learned something and contributed something as part of the work group. And this included people receiving and providing gender affirming care and people from immigrant, refugee, neurodivergent, and disabled communities. So for the quick timeline in which the work group was put together, I think we had a pretty good group of representation there. You can go to the next slide. All right, so for those of you that like flowcharts, this is just a visual representation of what we've talked about already. So a schematic of the different bodies that were involved in the work. It illustrates that it was really a collaborative effort. So you can see where we fall there on the right side of the screen with the Healthcare Workforce Committee. And you can see that we contributed members to this provider work group. The Health Equity Committee also provided members. And then the OHA, the Gender Affirming Care Committee, provided members. And that director request there was what prompted the origination of the group. So for those of you that like visuals, there's your visual representation. I am happy to pause here. We're going to move into a little bit more about the process of how the report came to be, but does anyone have any questions so far? All right, hearing none, I will pass it along to Koi.
Thanks, Elena. So if we can move to the next slide, I think it's the next two slides. I'm here to talk a little bit more in detail about process and timeline, really reiterating a lot that was already said, but going into a little bit more detail. So this, again, is a flow chart of the timeline that we had or have for presenting to you all, and also to get approval, as well as making recommendations to Dr. Haughey. So as you can see here, it shows that we started in September. Many of us probably remember from this work group, OHA staff came to us and presented the letter and recommendations from Dr. Haughey to create the committee. Some of us volunteered to be part of this, the work group itself, and we were able to start in October of 2024, but really early on, we realized and acknowledged that it was a short timeline to really get a report completed and submitted by the end of 2024. So we did ask for an extension, which we were able to receive, and was able to meet 6 times between October 2024 to January 2025. And again, with the help of our contractors and OHE staff, we were able to successfully complete the report by early January 2025, and to present the final recommendations to you all today, which is the first committee that we're presenting to. So we're now at the start of the first quarter of January 2025, March 2025 through March 2025. We are again making preliminary recommendations to the Oregon Health Policy Board subcommittees, which include us here at the Healthcare Workforce Committee and the Healthcare Equity Committee, which we are presenting tomorrow. We then will be presenting this report to Dr. Hati, and then the group will also then make a final report to the Oregon Health Policy Board later on in the month as well. We do anticipate that there will be some recommendations from the director's office giving us more guidance on what comes next and how to implement some of this, some of the recommendations that we're presenting to you today. Some of them will include short-term as well as long-term actions. Some of the short-term actions we're hoping to be obviously implemented early on, but we do acknowledge that some of the recommendations will require state-funded resources and potentially changes to current policies. And because what was acknowledged before with the current federal administration, much of this will probably require legislative action, which will then take place in 2026 and 27, maybe even longer. Next slide. This is a little bit more in detail of the general meeting topics that was covered in the 6 sessions that started again in October. We started with some baseline gender affirming care education for our work group, developed shared terminologies and shared analysis on gender affirming care concepts. Then we started to dive deep to develop, evaluate, refine through multiple processes, the recommendations that I'm presenting to you today. We want to also mention that work group members were able to contribute to these recommendations both in the in-person Zoom meetings as well as outside meetings through some of the homework that were given to us between meetings through surveys and open-ended questions. I also want to acknowledge really just through the support of skilled facilitators that, although the timeline was short, we did take time where we needed to take time to ensure that everyone's voice were heard and that the recommendations that we're presenting today is as complete as it can be. Next slide. And then this is the final submission, approval and submission timeline. We're here today at the Healthcare Workforce Committee, February 12th, presenting to you all, and it does require approval, which we will facilitate later. Tomorrow, we are presenting to the Healthcare Equity, Health Equity Committee, and then submitting the final report to Dr. Hati, waiting for recommendations before we submit it over the final report to the Healthcare Policy Board on March 4th.
Thank you. So with that background and hopefully context, we also wanted to provide this consideration, given that the timeline was really short to come up with the report, where we are grateful for the extension and the work group did incredible work in that time. However, one of our core recommendations is that we are requesting the formation of an ongoing gender affirming care advisory committee and that this be a top priority. We had really great representation on the work group, but we need to acknowledge that this was not broadly inclusive community engagement. We need to make sure that both providers of gender affirming care and patients who receive gender affirming care are really centered and are really involved in shaping future recommendations for policy actions. So we have our recommendation one is going to focus very much on the formation of an ongoing advisory committee that has very broad and inclusive community engagement. In recommendations 2 through 5, we're going to address some preliminary recommendations for workforce development, organizational changes, and access to gender-affirming care. And the ongoing Gender Affirming Care Advisory Committee may suggest additional recommendations that come from the broader community experience and including lived experiences. And again, highlighting the fact that we are in unprecedented time when there are currently overt movements to attack and reduce access to gender affirming care across the nation. Oregon has held a very important role in being one of the vanguards in the nation in increasing access to this necessary medical care. So this highlights even further the need for an ongoing advisory committee that will be empowered to create recommendations and help Oregon stay true to its commitment to eradicating health inequities by 2030. Next slide, please. So we're going to do an overview of our recommendations. The report has a lot more information in there, and I'll go over the structure of the report after we review our high-level recommendations. So start off with the first one, as I mentioned and talked about. This really calls for the formation of an ongoing gender-affirming care advisory committee charged with developing comprehensive, community-driven, long-term legislative and policy recommendations. Importantly, this advisory committee needs to have equitable compensation practices so that community members can actually participate and that this doesn't become an extractive practice. We need to make sure that this advisory committee has members that are representative of trans, non-binary, and gender diverse patients, providers, and allies with lived experience with gender affirming care, including those from Black, Brown, Indigenous, and other communities of color and rural areas of the state. And importantly, also, this advisory committee needs to have a clearly stated purpose, role, and decision-making power within organizational structures of OHA so that their recommendations actually lead to action as opposed to not really going anywhere. So we have a number of sort of additional information for each of these recommendations, but I'll hand it over now to one of our colleagues to discuss recommendation 2. Next slide, please.
All right, I can take this. I think this is a little bit more the free form part of the presentation. And so this recommendation focused more specifically on workforce development and training. And again, like Leah said, there's much more information in the report. So hopefully you had a chance to review that for the meeting today and or could take some time afterwards to dive deeper into that report. Here's a high-level overview of the workforce development recommendations that we've made. The first is to support gender-affirming care training for all providers and clinical staff. The second is to support gender-affirming care clinical competency training for applicable providers. And so these two we see as a pair. The first is that we want all team members that are providing care. My opinion is that many types of healthcare are gender affirming care. So this could also apply in oral health settings and behavioral health settings. Doesn't necessarily need to just be in medical health settings. And so this first one would apply to all teams that we're getting training and support. The second would be an evaluation specifically of those providers that are more directly involved in gender affirming care so that we can assess and confirm their competency. The third report would be to support trauma-informed care training for all providers and clinical staff. And so this is ensuring that we're providing that gender affirming care in a trauma-informed way. The fourth recommendation would be to support implicit bias training for all providers and clinical staff. Some of this is happening already, and we would want to make sure that that ongoing training incorporates gender affirming care and discussing gender identity when it comes to implicit bias. The fifth recommendation is to support training for the collection and utilization of REAL-D and SOGI data. And for those of you that don't know those acronyms, REAL-D is race, ethnicity, ability. Oh gosh, now I'm blanking on the. Neelam, can you jump in and race, ethnicity, and then I'm blanking on the A, L, and
Language
D.
and disability.
Thank you. And then SOGI, which is sexual orientation and gender identity. So those are what those acronyms are. And again, this is familiar to workforce committee members. We've talked about this data as we discuss our reports and data collection. And so this is just ensuring that that's consistent in the work that we're doing here as well. The sixth recommendation is to support recurring gender affirming care ECHOs, which that ECHO acronym is extension for community healthcare outcomes. These are virtual learning collaboratives that support providers across the state. So these would be collaboratives specifically for gender affirming care providers across Oregon. And then the seventh and final recommendation is to call for healthcare professionals, schools, which includes medical, nursing, physician associate, counseling. I might also include dental in there, to include gender affirming care training as part of their core curriculum. So that is a overview of the workforce development training recommendations. And then maybe Coy or Levi can take over for the third set of recommendations.
Sure, I can talk about the third set. The third set focuses on the recruitment, hiring, and retention with regard to workforce development. It's important to provide informational webinars about best practices and gender affirming care during the recruitment, hiring, and retention process. It's also important to provide support of the creation of a gender affirming care workforce learning collaborative, and also supporting the creation of a gender affirming care peer support group for providers and clinical staff. And then throughout this process, it's also recommended that affirming human resource policies are shared and promoted during the recruitment, hiring, and retention process, and that the barriers to credentialing and contracting are reduced, especially those that prevent trans and gender diverse mental health providers from entering or remaining in the workforce. And then lastly, it's important that we work with state and national licensing boards to require relevant gender affirming care knowledge and skills as part of their core competency requirements. And then continuing into the next slide regarding recruitment, hiring, and retention, it's also important to increase the number of healthcare professionals who pursue specialty surgical training related to gender affirming care, that we implement educational pathway interventions to recruit more trans and non-binary people into healthcare professions, to implement career retention initiatives to prevent burnout among gender affirming care providers, especially those who are trans and non-binary themselves. And we need to support gender affirming care extension for community healthcare outcomes, or ECHOs, to create a collaborative learning environment for healthcare professionals to receive peer support and continuing education. And we need to implement focused hiring initiatives to build a robust pathway of gender affirming care providers, focusing on increasing diversity and addressing gaps, especially in rural and underserved areas. And I'll pass it on to the next person.
Yeah, I can take the next. So can we move to the next slide? And I can take the next two slides. So this slide right here, the fourth recommendations on organizational change, which is recommendations in our in the service location as well as in our billing, and also in the surrounding area. So recommendation number 1 here is support gender affirming care organizational updates, including signage, billing forms, with our restrooms, ensuring that our policies in gender affirming care are incorporated through OHA funding, certification, and recognitions of the programs for the healthcare settings, and creating an infrastructure of gender affirming care extension for community healthcare outcomes. It's also recommending that we create create a support for gender affirming care peer support groups for providers, and then also ensuring that their electronic records, health records correctly capture and display chosen names, pronouns, and other gender-related information of the patients and of the community members. To reduce recommendation number 6 here is to reduce insurance barriers for gender affirming care, and then also to ensure that clinic staff through scheduling and billing also have the necessary training to engage with their gender diverse patients. And all of this for the next slide is to ensure that that our community members feel welcome and that people are able to access gender affirming care in a not only a safe but welcoming manner. And so we want to make sure that we increase telehealth opportunities as well for members who are accessing gender affirming care. We want to make sure that we invest in community organizations that provide also supportive services, wraparound services, healthcare, health-related social needs services to our trans and non-binary community members, including reimbursement mechanisms for non-clinical care, such as peer support, community health workers, and post-surgery care. And I would also include naturopathic care and others as well in here as well. And then determine where there are gender affirming care provider shortages in Oregon, followed by targeted interventions and increased number of gender affirming care in those areas in the rural areas as well, in areas that are lacking some of the services. And then finally, removing cost and other barriers to access gender affirming care. And that's potentially where legislation or even Medicaid waiver in the future may need to happen.
Thank you. So again, those recommendations are really the product of the work group focusing over the last few months and trying to develop comprehensive recommendations, a number of them which can be implemented in the short term, as well as again acknowledging that with a permanent formal gender affirming care advisory committee to move this work forward, to expand on those recommendations, to hone them further, and to really ensure that the voices of patients and their providers are centered in all decision making and all formations of these recommendations. So just to give you a sense of the recommendation structure in the report, as I mentioned, there's a lot more information that we tried to include along with the recommendations. So the recommendation is sort of how does gender affirming care provider recruitment, training, and retention in Oregon improve? The goals then for each recommendation is trying to make sure that we have clarity on what the ideal outcome would look like and what actual real difference would this make for people who are seeking gender affirming care. We also have a section in the report for each recommendation on implementation actions. So what are the activities that will be necessary to achieve those outcomes? We have potential resources where we try to brainstorm the work that what the work of community partners and or OHA has been done in this area, what resources can be really leveraged to implement these recommendations, and who is also really important to be partnering in this work. The obstacles and opportunities, we wanted to make sure to identify proactively as much as we could potential challenges and barriers, as well as potential strengths and assets that may already exist in order to implement these recommendations. Importantly, we wanted to make sure that we also were addressing how these recommendations address our anti-racist and increase equity. So what else can we do to make sure that we are moving forward towards anti-racism and achieving equity. And then again, also making sure how do we, with each of these recommendations, what is the role of community? How do we make sure community members are engaged and in order to make this work successful? Next slide, please. So we have a few questions for the committee. We also welcome your questions about the report. Again, our hope is for this report to be approved as well as to be approved by the Health Equity Committee tomorrow. So now I'd like to open it up, but here are some questions that we have for you to keep in mind. Number one, what will be the timeline for response and action based on this report's recommendations? If the Gender Advisory Committee is formed as we recommend, we would like to know and start thinking about where this committee will sit within OHA. Sorry, my cat is destroying things. How will it be staffed, resourced, and supported? We also wanted to know whether the Gender Affirming Care Recommendations Work Group that has existed will continue to meet. And then importantly, as we have referenced a number of times, how do federal policy changes affect this work? And again, with the threat of potentially Medicaid dollars being restricted or other legislative federal actions or executive orders impacting the state's ability to offer gender affirming care, what is OHA's role and how does OHA proactively ensure that there are no disruptions to this important care and this life-saving care for Oregonians? Thank you.
And then I'll just jump in that, yeah, the next probably 10 or 15 slides are the full recommendations. We're not going to go through those because you have the report. So we'd be happy to open it up to questions or comments at this time.
So, Jason, I see your hand up.
Yeah, thanks for all your work. Everybody was involved with this to create this. Just looking at the document, it represents a lot of work. It's very impressive. I do have some questions in regards to the workforce development training side of things. Not surprising, given my role as in education here. A couple things come to mind for me. Things like develop a standard, and I know that these things would be fleshed out more if the committee were created, but I just wanted to get some additional thoughts from the committee members on some aspects of this, including develop statewide competency standards. Is that, so right now, if I think about the breadth of healthcare education programs out there, the competency standards are usually set in the education realm by an outside accrediting body. Would these statewide competency standards be grafted on top of that, or would this be for people who are in the field and education programs are not expected to meet those competency standards? Does that make sense, that question? I guess who's overseeing those competency standards and who do they pertain to? Do they pertain to graduates of programs or people who are working in hospitals and clinics across the state?
Good question. It seems like something we'll need to incorporate in what's done with these recommendations moving forward, is to really look more carefully at that information.
Yeah, and all that to say, that's going to be a hot button topic in the education world if that becomes part of the mandate of a committee, is to implement statewide competency standards. So it might be beneficial to change that wording or put some caveats around that instead of develop, maybe explore something that's maybe a little softer there. And then in the potential resources section of that same one, it says potential collaboration with OHSU. it kind of gives the impression that OHSU will be the training organization here, or will be the hub at which the development of the training maybe revolves around. And I don't want to give any preference to OHSU in this. There are a lot of education institutions across the state, I think, who would be great partners to collaborate with. And so my recommendation is to strike that and reframe it as potential collaboration with healthcare education providers across the state. And I saw there's a chat there as well. So I'll stop there, and feel free to comment, or if I'm missing something, let me know.
I'll jump in. First of all, thank you, Jason. This is exactly the type of feedback that we were hoping for. And so I've jotted down your comments about OHSU and then maybe changing explore to develop. If I'm recalling, and Yulia and Coy and Levi and Neelam and everyone that was on the call, feel free to join in too. I think that the piece of competency, you are totally right. At least my lens is through dental, when ours is the Council on Dental Accreditation, CODA, and the intention was not to change national accreditation standards or anything like that. It was more to create a sort of like a what's coming to mind is like a seal of approval, sort of saying like we've been evaluated, our providers have been evaluated and have completed a certain set of training standards, have assessed a certain amount of competency, and that might give folks seeking gender affirming care a greater level of confidence and comfortability in going to a certain clinic or provider. If I'm missing pieces of that, please let anyone jump in and correct me. So I don't think the intention was to change accreditation, or I think there would be an encouragement to include education standards, but not to strip anyone of their accreditation for any sort. So I've made a note of that change of explore versus instead of develop. So Yulia and Levi, I see your hands are.
Yulia?
Sorry, I think Levi had his hand up. Sorry.
Oh, thank you. That's very nice. I think one of the thought processes was, for example, when you are looking at your insurance provider's webpage and you're trying to find a new provider, how is it that some of those providers have a part of their title or a list of what they're able to provide, identification that they are able to provide to us LGBTQIA plus care? How do they get that next to their name? And how do we promote those processes, and how do we help those processes happen more so that more providers can be designated as a safe person to reach out to with regard to gender affirming care? I think that's part of it. And how that happens, I don't know. Just
that's really
at ODHS. So thank you.
And Levi and Elena, that's really helpful. That's not how I interpreted that upon reading that. So I guess, the language might need to be tweaked to clarify the intent there. So outside observers kind of understand what the intent there. When you explain it to me, it makes 100% sense. And my confusion and question just melts away.
Yeah, I appreciate that comment, Jason. I think one thing that we really sort of struggled with is that the capacity of this workforce in the short timeline to develop, and that's why so much of us these are our preliminary recommendations that we have ideas for, and we need to clarify that language. We're calling for as many of these that are viable to be implemented in the short term. However, acknowledging this is again highlighting the need for an ongoing gender affirming care advisory committee that will be able to delve into each of these in turn and actually establish their formal implementation. That's why so much of the language here is support, and we need to make sure that this is, or move towards in language that really says we want this to happen. However, we're acknowledging again that we haven't had enough time or input from all the partners and folks who need to be involved in these conversations to come up with it, with sort of the nuance. So if there's other changes to make sure that language is clearly stated that, this is our suggestion and what we're calling for. However, we do need a lot more work on each of these to make sure that they're implemented thoughtfully, that they actually result in the outcomes that we want. With this one in particular, I think it was acknowledging that currently we really don't have, to Levi's point as well, there's sort of no way to really know if somebody has those competencies, and making sure that there is access to getting those competencies in a way that give patients the confidence that their providers can actually meet their healthcare needs in ways that are affirming, and that meet clinical standards.
And I'll shut up after this, I promise. The goals section there, you have a goal to ensure that every clinician has the skills and training necessary to provide affirming and respectful care to gender diverse patients. That combined with the developed statewide competency standards thing gives the impression that everybody at all levels is going to be required to have that training. And if that's the intent, okay, let's talk through that. If the intent is to provide providers the opportunity to get training so that they can have gender affirming care badge or next to their name, then those two things, I think those goals and that implementation action both need to kind of demonstrate the same thing. And right now they give the impression to the lay eye, which is me, that the goal is for everybody to have it, and the implementation is to develop statewide competency standards to get there. Does that make sense?
I think so. And I think if part of oh, I'm sorry. I'm sorry. I'm going to not talk over your head. Go ahead. Oh. I think one of the distinctions I wanted to just sort of name, or the things that we also didn't really maybe spend enough time on here, is what do we actually mean by gender affirming care, right? And then there's a kind of more narrow clinical definition of it is providing gender affirming hormone therapies or gender affirming surgery. It's the sort of actual clinical competency aspect of it. And then there's the broader definition also of gender affirming care, in that transgender and non-binary patients know that when they go to their providers, they will not be discriminated against, that they will actually get care that meets basic standards of quality and accessibility and inclusion. And so I think that's really something that also may create a little bit of confusion here, in terms of how these things actually may get interpreted. And again, I think your point, Jason, is really well taken, that we really need to be thinking about, okay, what specifically are we talking about here? What is actually feasible? What is actually doable? While also keeping true to the fact that all patients who see a doctor should be able to see a provider, or another provider should be able to get care that is respectful and affirming, and the clinicians having the skills to be able to actually provide that care. The exact ramifications of how that gets implemented, whether it would be something that the advisory committee would need to really wrestle with, and then come up with a formal recommendation for implementation. But language changes that we can make now to make sure to kind of not, one thing that we want to make sure doesn't happen, that we don't undermine the work of the future advisory committee by recommendations that this work group has made in a short period of time. So we want to make sure to create as much spaciousness for the advisory committee to actually do that thoughtful, community engaged work to come up with very thorough and effective recommendations.
Okay, folks, I'm going to need to cut us off here because we're unfortunately running against a schedule.
Ian, is it
But
okay if I just make one quick comment?
sure.
In regards to just gender affirming Oregon, I would say, and so I think one of the goals of some of the recommendations that we have is that we want to ensure that Oregon is gender respectful and gender affirming, and so that anyone, any community member who is transgender or non-binary can go to really any of our providers and feel that they're respected by the gender, their gender. And so and that's at all levels. And so, if we look at the organizational slide, we saw that it's not only our providers, but it's also our front desk staff, it's our billing folks, in our documentation and the way that we have signage. And so all of that, all of Oregon, just as we're talking about equity training, gender affirming care training or gender affirming training should be part of the trainings that we provide not only to our staff but also to our students who are to our students in any type of provider care.
Yeah, and I'll just add that, I oversee about 30 programs, and what we determine as clinician, I think, is part of that, clarification process. You know, Coy, what you just said there sort of perks my ears up a little bit, just around how do we get 30 programs to meet that recommendation? And I'm just half of the college, and when it comes to healthcare, it's a big undertaking, and I just want to make sure that we're leaving space for the complexity of healthcare education and the breadth of healthcare education, and what is required, what is not, what is recommended by the OHA, what is not, for all of these disciplines. And Ian, I know you've got to move us forward, so I'll stop.
Yeah, we have about 4 minutes left to respect everybody's time in the meeting, and so I apologize we didn't leave enough time in this. This is a hugely complex topic, and as we mentioned earlier, we didn't even start with very much time to do justice to it, but we do need to vote to see if our initial recommendations can be supported moving forward. So is there anybody who's willing to present a motion to approve the report?
I'll present a motion to approve the report. I think the importance of the competencies is there, but that's often a national endeavor, and that's far beyond the scope of what we do here. We may be able to affect some things in Oregon, but
And I'll second, just with a call to, I put in the chat an acknowledgement that, Jason, we can incorporate that feedback into our sort of presentations going forward. And I see a couple of likes to acknowledge that. So as long as you're comfortable with sort of this discussion, making some tweaks, taking out OHSU and changing it to statewide or educational programs, and then changing that language to be explore or support instead of develop, for some consistency and hopefully a little bit less of a elevation around that word. So hopefully that feels comfortable moving forward.
Okay, so anybody can we get yeses on approving the report? Raise your hands. Hey, anybody knows? Seeing no no's, any abstentions for any reason? Looks like we have an approved report. And now, Neelam, Deepti, do we have time to go through so our next slide, the planning for the report for next, 2025?
I think if people can hang on for a couple more minutes, Neelam and I can go through this pretty quickly. Do you want to start off, Neelam?
Yeah. And I also recognize if people have to leave, I completely understand and we'll follow up via email, which was our intention anyways. We just wanted to provide particularly the newer committee members some context. Jessica, if you wouldn't mind going the next slide. Following the 2023 Healthcare Workforce Needs Assessment, those of you who recently went through the orientation might recall that we had shared the committee's strategic framework that was developed and approved in May of 2023. It identified 3 broad areas requiring attention to make progress to develop a culturally and linguistically responsive workforce. And the committee then decided to create subcommittees corresponding to each area that develop strategy papers. And they're listed below in the areas. There was an introduction paper providing kind of an overview of this effort. Then in the areas of workforce diversity, wellness and resiliency, and development and retention. And then those of you who were with the committee this past September might recall we had talked about, interest in resuming these subcommittees after the 2025 Healthcare Workforce Needs Assessment was released. And thank you all for your many contributions to that.
Great. One of the things we wanted to do today was set up that we're going to be sending you a survey that really asks your input for what to do in terms of next steps with the 2025 Healthcare Workforce Needs Assessment. As you know, the report was long and it had over 40 policy recommendations that were workforce related. And so we thought that it would be more useful if we could go through the recommendations and set a priority for some of them. So the survey will be shared next week with you, and we're asking for your input in terms of how to prioritize those policy recommendations and also your availability to serve on subcommittees that might result from that prioritization. Because we know that it's a significant investment of time and resources to get those subcommittees again, get started again, to staff them, to lead them, to truly participate in them. So the survey will try to gauge all of that. We'll be discussing the results and having a broader conversation about this at our next meeting.
Great. Deepti, one question. Will we be just surveying based on the existing 40 items, or will there be an opportunity for the community and the committee to provide input on other possible ways we could look at this, since the different areas may no longer be the only direction we want to go in?
Absolutely. We will provide space to get your thoughts about what the next step should look like. That may involve resuming the subcommittees. It may be a total different approach. We would like to hear all of your thoughts about that.
Great. Okay. And committee members, any questions? Okay, our next meeting is March 5th, 2025, 9:30 to 12:30, I believe. So thank you all for great participation and supporting the work we're doing.